today what we're going to discuss is just the surgical steps that go into the all-on-4 dental implant procedure that you choose to have when we've determined that you're a candidate. I'm Dr. Jordan Heimer with Nuvia Dental Implant Center, and so here at Nuvia Dental Implant Center, patient experience and safety are our top priority. We don't want you to feel uncomfortable when you come in, and being that safety is our #1 priority for the day of surgery, we choose to use a separate anesthesiologist from the surgeon. And in order, that way that person monitors your safety and your sedation for the length of your surgery, and the surgeon is able to focus on the surgery. That results in a shorter surgery time. Day of surgery, what's gonna happen is you're gonna show up at the center and you're gonna be met with a dental assistant. From there, we're gonna bring you back into our surgical operatory. Our first procedure is anesthesia, it's sedation. And so the anesthesiologist is gonna meet with you and they're gonna get you nice and comfortable. We're gonna lay you back and then get you drifted off to sleep. And it's really comfortable. We're not using any gas anesthesia, so that kind of prevents any of the nausea feeling that you have had if you've ever experienced that at a hospital setting. The sedation that we offer here at Nuvia is a little different, and it's to combat those feelings upon wake up. Once that anesthesiologist has you drifted off to sleep and really comfortable, moving forward, then the surgeon's going to come in, and the surgeon is going to start with a little bit of local anesthetic. And so it's the same numbing that you have at a dental office, but you aren't going to feel a thing. In doing that, what we do is we're helping our anesthesiologist so that they can run less medication during the sedation to keep it a safer procedure. And also that way when you wake up, there's no discomfort from this procedure. Your mouth will be nice and numb. And so after that local anesthetic is placed, and we always generally start with the top, then the surgeon is going to make a small incision. And that incision is going to go across the whole upper arch. And what that allows us to do is then we kind of gently push the gums out of the way. And by pushing the gums out of the way, what we're doing is we're just maintaining our access to the surgical site. And that's going to allow us to see what we're working with. Then the surgeon is going to remove the teeth. And we do this by kind of gently loosening up the teeth, and then they're removed. After that removal of the teeth is done, we then take some instruments and we take the bone and smooth the bone down to that line that we've made. Then we go into placing our implants. So on surgery day, in the middle of the procedure, we determine the best locations for your dental implants. In this procedure, when we're looking for the best 4, we're also looking to skirt any the anatomy that's in the jaw. And generally, in the top jaw, that's our sinuses. In doing that, we take the 2 posterior implants and we tend to tilt them. And in tilting them forward, we kind of increase the distance between your front and the back implants. And that way we can give you the full 12 teeth that we place on the prosthetic. We're giving you as many teeth as we can in your dental prosthetic. Once those implants are placed, we've measured the snugness on the bone, or in the bone, and because we place these implants at different angles in order to have the best snugness, the best spot for those implants, those pieces then correct those angles. And in doing that, it allows us the prosthetic to all fit, one piece and fit really passively on your dental implants. Then it becomes a process of finalizing the surgery on that respective arch. After we've completed the top, we then go on to the bottom, and it's a very similar procedure, except when we move the gums out of the way, we're looking for what we call the mental nerve. That exits the jaw, and that gives your lip all of its feeling. And so we push the gums out of the way for that, so in doing the procedure, we don't injure that nerve. After the surgical procedure is finished, your surgeon will probably renumb everything to make sure that you wake up comfortable. Then you're woken up from sedation. And once you're awake, our restorative doctor is going to come in and do their thing to start taking records to rebuild your smile. There you have it. That's our surgical process for your day of surgery here at Nuvia Dental Implant Center. If you want to find out if you're eligible for Nuvia's permanent teeth in 24 hours, go ahead and click the link right here. Or if you want to keep watching videos like the one you just saw, go ahead and click the link right here.